Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today, we're exploring a fascinating and vital topic: the connection between oral health and cardiovascular disease. It's a link that's gaining a lot of attention in recent research, and for good reason.
Exactly, Emma. It turns out that conditions like gum disease and dental caries don't just stop at your mouth. They can have serious implications for your heart health, too. We're talking about an increased risk of heart attacks and strokes, all stemming from what's happening in your gums and teeth.
That's right, Alex. The bacteria that cause periodontal disease, for instance, can enter your bloodstream, triggering inflammation. This inflammation is a major factor in the development of atherosclerosis, where your arteries harden and narrow, leading to cardiovascular diseases.
And it doesn't stop there. The oral microbiota, essentially the community of bacteria living in your mouth, plays a significant role in systemic inflammation and metabolic processes that impact cardiovascular health. So keeping your oral health in check can actually be a vital step in protecting your heart.
It's a fascinating and somewhat alarming connection. Oral health isn't just about avoiding cavities or bad breath. It's about maintaining your overall well-being. Research shows that more than 90% of U.S. adults have experienced dental caries, and a significant portion of them remain untreated. And periodontal disease is affecting nearly 60% of adults aged 65 and older.
These statistics are alarming because untreated oral diseases can exacerbate systemic inflammation, which in turn can contribute to the onset of cardiovascular diseases. This makes it clear that oral health is a critical component of overall health, not just a cosmetic concern.
And the connection is even stronger when we dive into the specifics of periodontal disease. Studies have shown that individuals with severe gum disease have a higher incidence of cardiovascular events. The bacteria from the gums can directly infect vascular tissues, promoting plaque formation in arteries. Inflammation from gum disease also increases systemic inflammatory markers, which further drives heart disease processes.
It's a complex and multifaceted relationship, Emma. But the takeaway is simple. Maintaining good oral hygiene can serve as a preventive measure against cardiovascular diseases. And this isn't just about brushing and flossing. It's about understanding how your mouth health impacts your whole body.
Absolutely, Alex. Let's talk about the role of the oral microbiota here. Dysbiosis, or an imbalance in the oral microbial community, is often found in people with periodontal disease. This imbalance doesn't just stay in your mouth. It can lead to systemic inflammation and even alter metabolic pathways, contributing to conditions like hypertension and atherosclerosis.
And recent advances in microbiome research have really highlighted this. The oral bacteria can even influence the gut microbiome, exacerbating systemic inflammation and metabolic disorders. It's a reminder of how interconnected our body systems truly are.
That's a great point, Alex. And we also need to consider the role of cytokines, those small proteins that play a key role in cell signaling. Elevated levels of certain cytokines, like IL-6 and IL-17, have been found in individuals with advanced periodontal disease. These cytokines don't just contribute to gum inflammation. They also have broader implications for cardiovascular health.
Right, these cytokines can promote systemic inflammation that influences cardiovascular risk. For example, IL-17 has been positively correlated with the severity of gum disease, and this can lead to more significant cardiovascular problems down the line.
And while we're talking about inflammation, we should also mention harmful metabolites like trimethylamine N-oxide, or TMAO. Produced by certain oral bacteria, elevated TMAO levels have been linked to increased cardiovascular risk. On the flip side, some beneficial metabolites, like short-chain fatty acids, can have cardioprotective effects. It's a delicate balance.
That's why understanding these mechanisms is so crucial. It helps us see how poor oral health can cascade into more severe systemic issues, particularly cardiovascular disease. And it reinforces the importance of regular dental care and good oral hygiene.
Absolutely, Alex. This brings us to the public health implications. We need to emphasize oral hygiene and regular dental checkups, especially for high-risk populations. Primary care providers should consider integrating oral health assessments into routine care. And there's a real need for educational campaigns to empower people to take control of their oral health, which in turn can help reduce systemic diseases.
It's clear that oral health is a public health priority. But now let's turn to our herbal remedies. What natural solutions can we offer to support both oral and cardiovascular health?
One of the best is green propolis. It's known for its antimicrobial properties, which can target oral pathogens like Porphyromonas gingivalis. This helps maintain a healthy oral microbiome and reduces the risk of bacteria entering the bloodstream.
And for combating systemic inflammation, curcumin is a powerful option. Its anti-inflammatory and antioxidant properties are well documented and can benefit both periodontal and cardiovascular health.
Omega-3 fatty acids are another essential component. They help reduce inflammation, lower atherosclerosis risk, and improve lipid profiles, making them beneficial for both your heart and your gums.
Green tea extract is also valuable. It contains catechins like EGCG, which have antimicrobial effects against oral pathogens and anti-inflammatory properties that support cardiovascular health.
And let's not forget coenzyme Q10 and vitamin C. CoQ10 supports gum healing and cardiovascular health, while vitamin C enhances collagen synthesis and reduces inflammation, benefiting both oral and systemic health.
Finally, garlic extract is a powerful antimicrobial that can reduce oral pathogens and lower cardiovascular risk factors like hypertension and cholesterol levels.
These remedies, when combined with good oral hygiene practices and regular dental care, can make a significant difference. But always consult a healthcare provider before starting any new supplement regimen, especially if you have pre-existing conditions.
And remember, quality matters. Choose organic and sustainably sourced products to get the most benefits. And pair these remedies with healthy lifestyle practices like stress management and regular sleep.
In conclusion, the connection between oral health and cardiovascular health is a crucial area of ongoing research. By prioritizing oral hygiene, we can help prevent not just dental issues, but also systemic diseases, improving overall health and quality of life.
Thanks for joining us today. We hope this episode has provided you with valuable insights into how taking care of your mouth can also protect your heart. For more information, visit herbalbloom.org, and don't forget to subscribe to stay updated on our latest episodes.
Take care of your health, stay informed, and we'll see you next time on the Lost Book of Herbal Remedies.
See you next time.